Hey folks, Dr. Joe Esposito here. Glad to be with us today. What we're talking about today is supplements. Now, I've got a pretty good background in supplements. I've been studying biochemistry and supplementation for about 40 years now, and I've got several degrees in the area. So we're going to talk about supplements, but there's some things I want to caution you about because I've had in the past patients coming in and saying, well, Dr. Joe, I'm taking this and this and this and this, and I bought it over here. I bought it from a big box store. Quality is everything. In life, quality is everything. My grandfather, and I've quoted him many times, said, always buy the best. It's always cheaper. And when I was a child, I didn't understand that, but he was an immigrant from Germany, and he was a carpenter, and he came over in 1922, and he was a German in Hoboken, New Jersey, fixing the ships that came into the docks in the Hudson River there, because Hoboken's right along the Hudson River, that were hit by torpedoes, and then sending them back out to war. So he was a German, didn't speak English, in America during World War II. There's a brave man right there, and a big mountain of a man. But he didn't talk much. But when he did talk, he would say, always buy, one of the things he told me, always buy the best, it's always cheaper. And he was a carpenter, master carpenter, and he had a few tools. And he built amazingly beautiful things with just a few tools. Why? It was quality that he had in his life. And I want you to think about that when it comes to your health. Always buy the best, it's always cheaper. I wouldn't want to go to a discount brain surgeon. If I need a brain surgery, I would say, who's the best? And who's his doctor? My mother always says, go to your doctor's doctor. You know they're good. So I would want to go to the best doctor's doctor because I know they're good. And that's how I feel about when it comes to supplements and my health too. I only want to be treated and take the best. So something you want to look for is something called a GMP. It's called a good manufacturing practice. And where we get our products manufactured, strictly controlled, very rigorous standards, routinely passes FDA and third-party audits, extensive testing on every product, and to make sure we have consistency and purity. Now, one of the things with our products, the Super Greens, the Essential Source, they're made with all natural ingredients. And so sometimes a batch might be a little different color, a little different flavor. That's because if, like for Essential Source, for example, we use fruits and vegetables. So if I were to pick an apple from the east side of the orchard in the beginning of the season, and then a west side of the orchard at the end of the season, they might have some different consistency. Still a good apple. But with the Super Greens, the Essential Source, that's one of the ways you know how pure it is. Because we're taking whatever ingredients are available at that time, and we're mixing it into the powders. So the quality is consistent, but sometimes the color is a little different or the flavor is a little different. Nothing to worry about there. And that just tells you that we're using all natural ingredients. So that's just a good thing. With the pills, you can't tell because they're in pill form, but this, because it's a powder form and you're tasting it, you're seeing it, it's a little different. So that is just another way that you're assured that the composition is quality and that we're using fresh ingredients. We don't want to get synthetic supplements. And that's another biggie. There are natural supplements and then there's synthetic supplements. Now, synthetic supplements, in theory, are exactly the same. They're made in a laboratory and they're supposedly exactly the same, but they don't work the same. The molecules are slightly different and they don't have the same effect. A good example is vitamin C. Vitamin C, pure whole vitamin C, is effective in many, many research studies. When you look at a synthetic version, you might get something called ascorbic acid. Well, technically, it's the same molecule, but it's actually 1/8 of the entire vitamin C molecule. So if you're using ascorbic acid, you're not getting the same effectiveness as you would with pure 100% vitamin C. Research says it's the same thing. Science says it's the same thing. Yet when you finally put it to the test in clinical studies, you don't get the same results. So you want to make sure you're not taking synthetic supplements, and that's really important. And our supplements, none of them are synthetic, so you don't have to worry about that there. Now, there are some precautions I want to warn you about when it comes to taking supplements. Supplements are safe, but like anything else, you got to be careful with them. Most supplements are safe. This was interesting. If you smoke, anybody still smoke? Not a lot of people smoke. High doses of beta carotene have been linked to greater risk of lung cancer if you're a smoker. Now, it sounds counterintuitive because you're taking supplements to fight disease, but if you smoke, you're kind of changing the rules. So if you smoke, just be careful with that. Now, I don't want you to stop taking the beta carotene. I want you to stop smoking. And that's the thing that always gets me. And I have this a lot. I'll talk about vitamin K in just a second. Well, let me get to vitamin K. Let me catch up to that. because this is something that's interesting, and this is where you really got to know what you're talking about when it comes to supplements. If you're taking calcium and vitamin D, too much of it can lead to kidney stones. But there's different types of calcium. Once again, that's a general statement. So if I'm the public and I'm saying, well, if I'm taking calcium and vitamin D, that can be good, but too much of it can be dangerous. Yeah, but it's the type of calcium. If you're taking calcium carbonate is not the natural form. And calcium carbonate can actually block up your receptor sites so you're not absorbing the calcium as well, like calcium citrate or lactate. So calcium is good. A, you probably don't need it, and I'll explain why in a second. But B, if you're taking calcium carbonate, that's where the danger comes in. So again, the studies might say, yeah, too much calcium is bad, but what type of calcium? What are you taking it with? What's your diet consist of? So just a generic broad statement when it comes to that is not sufficient to give you the information that you need about the health or the dangers of taking a supplement. High doses of vitamin E may lead to stroke caused by bleeding in the brain. Well, yeah, but you have to take it off a lot. And so these are warnings that are out there, but the warnings are so few and far between. I know they talked about, you might hear kava kava is dangerous if you take too much of it. Yeah, but not a lot of people take kava kava. So when you look at the risks, those are pretty much it when it comes to supplements. Now, if you take too much vitamin B6, you might get numbness or tingling. If you stop taking the B6, the numbness goes away. So yeah, the risks are there, but the risks are infinitesimally small and almost non-existent if you're taking the right amounts. Now, sometimes there is megadoses involved. I know if I start feeling under the weather, I always recommend 5,000 international units of vitamin D every day. Now, with spring and summer, if you're out in the sun, 10, 20 minutes a day, 3 times a week, 4 times a week, you probably don't need to take so much vitamin D. But most of us are inside all day. A lot of people, like me, go from my house to my car, because my garage is attached to my house, drive to the office, get out of the car, walk into the office. I'm inside all day. Then I might go out at lunch. I try to get a walk in if I can. Many times I don't get that opportunity. And then by the time I go home, the sun is not high enough in the sky to give me enough UVB rays to create vitamin D. So if you have that lifestyle, which a lot of you do, I'm going to recommend you take vitamin D. Now, if I start feeling under the weather, I'm going to take, instead of 5,000 international units, which is 5 drops, I take 50,000 international units. So that's a lot more vitamin D, but I only take it for 3 days. After 3 days, I cut back to 5 drops again because I don't want to overdose my body, but sometimes you need a little boost. So once again, you got to understand what you're taking, how you're taking it, and the quality of what you're taking. Now, vitamin K can interfere with anti-clotting effects of blood thinners. So you're on blood thinners to keep your blood thin. You take vitamin K, it can cause the blood to clot. All right, here's the conundrum that I've asked several doctors, and no one has the answer. I do, of course. Is it vitamin K1 or vitamin K2? I don't know that. I just read somewhere that vitamin K can be bad if you're on blood thinners. Well, vitamin K is necessary, first of all. Vitamin K1 helps with blood clotting. Vitamin K2 actually directs calcium that's being absorbed into the bones and out of the soft tissue. 2 different types of vitamins, but they both have the same name. But they act differently. And so that's a big issue. And so just randomly reading something on the internet or reading something in research and saying, okay, vitamin K is bad, I can't take it, I'm on blood thinners. My question comes up. Why are you on blood thinners? And if you're on blood thinners, is there something you can do to get healthy enough so you don't have to be on the blood thinners? I have never told a patient to come off medication. I have gotten countless patients well enough that they don't need medication. My team of doctors and I shouldn't say just me, my team of doctors and I. So, yeah, there can be problems, but why don't we get to the cause of the problem and not just treat the symptom? Now, sometimes you have to take medication forever. I am not against that. I support that 100%. I have someone very near and dear to me who had her thyroid removed. She has to have thyroid medication the rest of her life. I support that 100%. But things like blood pressure, diabetes, many times blood thinners. Maybe you put you on blood thinners because you have a weak heart. Well, why do we have a weak heart? Again, I like to dig a little deeper, and I think you know that by listening to my shows in the past. I don't accept anything at face value. I want to dig in and find out what the science and the research is saying. And the science and research is saying you need to know what you're talking about. And so you just got to be careful about that. Now, there are some supplements you got to be careful with, like fat loss supplements. There is no supplement that will make you lose weight. Now, many of them are stimulants, which will increase your metabolism, but you can burn out your adrenal glands, get your heart beating faster, raise your blood pressure. So if you're taking a stimulant, yeah, you might lose weight, caffeine, cocaine. You might lose weight taking these things, but they're not good for you. So there is no quick fix. There is no promise of I'm going to take this supplement and it's going to be the greatest thing that ever happened and I'm going to be thin. Doesn't work that way. That's not how metabolism works. As far as I know, we've never discovered anything. Now, there are things that may help metabolism, but if you're going to get to the point where it's actually causing you to burn so many calories you're losing weight, it might be too much of a stimulant. So once again, you got to know what you're talking about when it comes to supplements. Now, it seems like every corner of the internet is stuffed with ads for vitamins, herbal remedies, fat loss supplements, muscle building. So here's a few things I want you to be careful about so that you can make some better decisions. Number one, not everybody should take the same supplements. Now, on our website, drjoe.com, we have several supplements that the Dr. Joe brand, and each one has a specific need. But if you're going to take Dr. Joe's estrogen regulator, I take it every day. Estrogen regulator helps prevent testosterone from converting into estrogen. Great for men, great for women who are childbearing years. If you're perimenopause or menopausal, do not take this. It's not for you because at this point, your estrogen levels are dropping, perimenopausal and menopausal. We don't want to lower it anymore. And when I was first putting the supplements together, I had a gal I knew and she was menopausal. And I said, I want you to take these. And after 2 days, she was not doing well. So I said, let's come off it. We did, and she was fine. So yeah, we got to find out what supplements are going to work for different people. I weigh about 175, 180 pounds. So I can take 5 drops of vitamin D3. If I was a 2-year-old or a 3-year-old, you wouldn't take that much. So you got to look at not every supplement is the same for everybody. What's your diet? What's your lifestyle? What's your fitness level? What's your sleep habits? What's your health status? So you got to be careful with that. Nitric oxide is one of our very popular supplements. Nitric oxide opens up your blood vessels. Works great. A lot of patients take it over the years, lower their blood pressure, and many of them are able to come off their medication. We have people that we take the nitric oxide, increases their brain function, increase their energy level. I got to be careful because when I put it together, I formulated it so that 4 a day was a good dose. Some people, if they take it, get real edgy. I've had patients, very few, but patients say, Dr. Joe, when I take it, I feel really edgy and anxious. So let's cut you back from 4 a day to 2 a day. Let's see how you do. I do better at 2. Okay, maybe cut you to 1 a day. I'm not doing as well. So we got to find out what's going to work best for you. And so just like every patient that comes in our offices, we customize a treatment plan for them. There's some basic outlines we use for all our patients. There's some basic nutrition outlines we use for everybody. But generally speaking, we have to say, that's generally speaking. If we get specific, we have to customize the plan. Some people need to have their stomach adjusted. Some people need to have their shoulder adjusted. Some people need their spine, their foot. So we customize a plan for all of our patients. And in our office, we have what I call escalation of care. When you come in, we start out with a consultation with one of our doctors. If we think we can help you, no promises. We do exam, x-rays, first chiropractic adjustment, next visit, go over your x-rays, and then put together a treatment plan for you and do a nutritional evaluation. And our nutritional evaluations are customized. So everybody gets a customized plan for their specific treatment. Not everybody needs the same amount of visits. Children usually heal faster than old people. If there's a car accident, it's going to need a lot more care. There's probably muscle damage, ligament damage. Then we can do a medical evaluation. We can have our physician's assistant or a medical doctor review the case and say, we think we need some medical intervention. Maybe you need trigger point therapy. Maybe you need injections into the spine, nerve blocks, median branch blocks. So we can do this for the patient, and we combine chiropractic and nutrition and medicine. And then we add interventional medicine for injections. Sometimes we have to refer the patient out for more evaluations. We had a patient the other day after his car accident, couldn't even look at a car. He was so freaked out at cars because of the accident. We sent him to a therapist who does post-traumatic stress disorder counseling. They needed counseling after the car accident. We have orthopedists we work with, neurologists, dentists. I had somebody come in the other day after a car accident, chipped a tooth. Well, I sent him over to Dr. Ranch, one of my good friends, and he went ahead and fixed the tooth for them. So we work with a team of doctors. And so when you come to our office, you can feel comfortable in knowing that we can work with you in whatever direction we feel is necessary. Some people might need PRP. PRP is platelet-rich plasma. We take your blood cells, your own blood cells. This is not a drug. This is not some baby's umbilical cord cells. We take your own cells, take them out of the blood, called platelets, and re-inject them back into the body. This is super high concentration of growth factors. It stimulates growth in that area. And many, many people do great with PRP for pain, arthritis. I had PRP and exosomes done in a disc that I had crushed in my neck when I was 10 years old. Great results. So we want to look at what is the best option for you. And just like with supplements, we try to customize a plan. Oh, by the way, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. We would love the opportunity to be your doctor. So if you have an ache or a pain or a digestive issue or headaches or car accidents, folks, if you've ever been in a car accident, ever, in my opinion, if the car was damaged, you were damaged. You want to get to see us immediately. And when you call it you're in a car accident, we make the plans work. We make plans and schedule changes for you because you got to get in right away. My doctors fill up very quickly. So if you want to make an appointment, go to our website, drjoe.com, drjoe.com. Book your appointment right online. You have the 4 offices. You can click on the office and make an appointment or call us. And when you call us, 844-44-DR-JOE, 844-44-DRJOE, you can call us. We'll book you an appointment. The initial visit, exam, x-rays, consultation, first adjustment, going over the x-rays, and the nutrition evaluation normally is $375. We've reduced that to $199. Now, that won't last forever, of course. So you can come in, get all that treatment done. If we move past the consultation, you're going to need more than one visit, I promise you. So we accept insurance for that, for treatment after that. We accept Medicare. We have doctors that are in several, all the policies. We're trying to get all the doctors in all the networks, but some doctors are in almost all the networks out there. So we can make this work for you. So go to our website, drjoe.com, book an appointment right now for you, your friends, your family, and your children. Children need to make sure their spines are correct too. So as we're going back to supplements, choosing the right supplement, very important. Supplements are just that. They're a supplement. They supplement a good diet. They're not in place of a good diet. So they don't replace whole foods. You can't outrun your fork. So you can say, well, Dr. Joe, I work out all the time and I can eat whatever I want. If that's the case, you're lying to yourself. Because I have a lot of patients that are amazing athletes, work out 4, 5, 6, 7 days a week, and I do blood work on them, they're very sick. We do nutrition evaluations on them, they're very sick. They can't lose weight. You can't outrun your fork. No matter how much you work out, diet, in my opinion, 85% of your health. Exercise, 15%. I'm not saying don't exercise. I'm saying that diet is way more important. A couple of things you got to be careful with. If you take a fat-soluble vitamin, vitamins A, D, E, or K, make sure you're taking it with something fatty because it's fat soluble. It absorbs better. So our vitamin D, which we talked about earlier, I think everybody should be taking 5 drops a day unless they're out in the sun a lot. Vitamin D, we put K2 in there because they're both fat soluble. K2 helps direct calcium in your body to go into the bones and not into the muscles. That's why you need K2. We put it in an oil base. So it's easier to digest and absorb. If you're taking a multivitamin, you still need to eat fruits, vegetables, nuts, and seeds. You can't just be eating alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, and then say, well, I'm going to take Dr. Joe's Essential Source and expect to get these amazing results. You'll probably get amazing results, but not as amazing as you would if you're eating a good diet. So once again, a supplement is just that. It supplements your diet. If you're taking vitamin D supplement and not getting enough calcium, that can be an issue too. But here's the thing with calcium. You probably don't need more calcium. You need less acid. Now, the acid foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, when you put these foods in your body uses calcium to neutralize those acids. So if you're eating a high acid diet, you're utilizing a lot of the calcium you have to neutralize the acid. What if, just saying, what if you go to a low acid diet? Cut out the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Then multiple things happen. You're eating more fruits, vegetables, nuts, and seeds, which is giving you plenty of calcium. You're not using up so much calcium because you're eating so much acid. Thus, you have plenty of calcium. So in most cases, you don't need an extra calcium supplement, or certainly not a lot of extra calcium supplement, because too much calcium can be dangerous too. And that's the big problem I find with people. Sometimes they take too much. You can overdose on vitamins and supplements. Taking too many vitamins, it's not always fine. Again, the fat-soluble ones, A, D, E, and K, we got to be careful about. Even minerals like zinc. Zinc is really important for your immune system. And if you're eating a lot of legumes and lentils and things of the sort, nuts, beans, you're probably getting enough zinc. Dr. Joe's Essential Source, which of course is the minimum supplement everybody should be taking every day anyway, that's again a general rule, has zinc in it. Probably has enough zinc. If you're eating a good diet and that, you're probably getting enough zinc. Now, if you get a scratchy throat, runny nose, early stages of feeling sick, then you could suck on a zinc lozenge, because the zinc lozenge will eventually just kind of drip down your throat and bind to viruses. That's how zinc works. If you're taking it internally and you have viruses in your throat, it may not work as effectively. So eating a good diet with zinc is important, but then you throw a zinc supplement on top of that, not a lozenge, but a supplement, it's not something you might want to do. You're probably getting too much zinc. So if you're drinking a lot of these pre-workout supplements, they may be high in caffeine. I know it's really not a supplement, but some people call it that. That can cause irregular heartbeat. I'm not a fan of caffeine. If you listen to the show we did on coffee, we cover caffeine and coffee. Go to our website, drjoe.com. Type in the word coffee. Listen to the show we did on coffee. We break down caffeine, how dangerous it is, and we also talk about what to do to give you energy. My energy protocol, Super Greens, Essential Source, nitric oxide, B complex, and adrenal support. Promise you, if you do that for a couple of days, you're going to get all the energy you'll probably ever need. Now, it may not happen the first day. It may take a while to build up in your body, but it works pretty great. Sports drinks can give you too much potassium, and that can lead to muscle weakness, fatigue, nausea, and even arrhythmias. The heart can beat irregularly, so that can be dangerous as well. Supplements can interact with medication. Again, vitamin K1 and K2, we talked about that earlier. St. John's wort is one of them, can treat depression, but that can affect your serotonin. So really the big ones that everybody talks about is vitamin K, St. John's wort, kava kava. So there's not really a high risk as long as you're taking them and you're being smart. And once again, if you're taking with medication, can it interact with medication? Absolutely. But again, I want to find out why you're on medication and then try to find out what we can do to hopefully get you off the medication. I am not against medication. I'll say this 1,000 times. But if we can find ways to get you off the medication, that's our goal. So if you do have a healthcare problem, neck pain, back pain, shoulder pain, headaches, numbness, tingling, folks, make an appointment. Stop suffering needlessly. This week alone, I walked in a room, 4 different new patients. I had a lot more than that, but 4 new patients all said the same thing. Dr. Joe, let me start by saying, why didn't I come here sooner? Because I always joke, why didn't you come here sooner? So stop suffering. Go to the website, make an appointment. Let's try to get you well and keep you well for your pain, digestive issues, nutritional concerns. We have a medical division as well. Go to the website, drjoe.com, drjoe.com. We have a drop-down tab of all the services that we offer. Call us, make your appointment. Also, I want you to follow us on social media. This is your homework assignment right now. Facebook, Instagram, and YouTube, at Dr. Joe Esposito. We need your help because the more followers we have, the bigger we can get this message out. So if you're listening and you like what you're hearing, go to the web, go to social media at Dr. Joe Esposito. If you're a podcast fan, this is one of our podcasts, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it, and you can get Dr. Joe all day, every day. And our website also has about 1,500 hours of podcasts. Any questions, send them to me through the website, drjoe.com. Tell your friends about the show. We'll be right back.